I'm just reading a question here from Steve. What does my vet who normally does dentals on horses need to know about donkeys? Gemma, are we going to cover that?
Yeah, we'll cover some of the treatment considerations that you'll need for donkeys for sure. But if there's anybody who wants to contact me afterwards, if they want extra help with their donkey clients, then I'm more than happy to chat to them.
Fantastic. That's good. Okay, well, I think then in that case, what we should do is we should probably get started, Gemma, if that's all right with you. So
yeah.
You're all read about Gemma's qualifications, her massive experience, her brilliant knowledge, her passion for everything equine dental, and she's embarrassed already just by saying how great she is. So I'm really looking forward to this too. The only thing to say is there are a few slides with some gory pictures, and there's a little warning that comes up before that. So if you need to look away, if you're having your lunch because you're watching from your desk, then there's opportunity to do that. So pay attention to those bits. Other than that, over to you, Gemma.
Brilliant. Thank you, Ben, for that very kind introduction. I will just start sharing my screen. Hopefully you can all see that. So before we start, Ben just let me know that there was about 82 people who had signed up for this webinar. And some of you are sanctuary staff and others are donkey owners. But let's say for argument's sake, you're all donkey owners. We know that donkeys should be kept ideally with another donkey. So those 82 wonderful people that are the other side of the internet from me right now, you could be representing about 164 donkeys. Something like 120 to about 131 of those donkeys could be suffering from any degree of dental disease right now. So dentistry is a really important aspect of donkey management. So it seems a bit odd that I would be questioning why do we bother looking at donkeys' teeth when dental disease is so prevalent. It's even more boggling when we think actually 95% of donkey foals are born with good teeth. So what's going on between them being born with good teeth and ending at 73 to 80% of them suffering from dental disease? So some of the things that we're going to talk about today, we're going to cover elements that are going to help us answer this question of why bother looking at donkey's teeth. In order to do that, we're going to look at a brief look at evolution, some anatomy and physiology, and the impacts that domestication has upon dental health. We're going to, as Ben said, we're going to look at some pictures, and there will be a screen that comes up to warn you beforehand if you'd rather not see some of those. Looking at some of the common findings in donkeys' mouths and the welfare and the impact on quality of life some of these dental diseases have. And it's a little bit disjointed at the end, but one of the questions I had from somebody through Facebook not so long ago was including some treatment considerations when dealing with donkeys. Okay, right, why bother? These are some of the questions. They haven't really changed since about 2006 when I qualified as a dental technician. They're not all questions that are posed to me directly. These are quite often the ones that you hear murmurings in the background of an audience. Donkeys don't get dental treatment in the wild. That's quite true, they don't. My donkey is well covered, therefore he cannot have a dental problem. So in our minds, we're making a link between dental function and dental pain and body condition. My donkey's too difficult to be dentaled. Or one that I've heard quite often is that the last person that came to look at my donkey's teeth traumatized them, and I don't want to go through that again. My donkey's too young or too old to need dental care. I would know if there is a problem. My donkey's not ridden or driven, so it doesn't need dental treatment or care or examinations. And dental treatment sounds like a money spinner, and you have no idea how much I wish it was. but actually there are some welfare implications to dental treatment. So I'm not going to answer these questions directly. What I'm going to do is give you the information so that you can hopefully answer them for yourself. We said earlier about dental disease having a prevalence of between about 73 and 80%. That's across all ages of living donkeys. Dental disease is the second most common medical condition of the donkey, and that comes after feet conditions. At post-mortem, that prevalence raises to about 93% or thereabouts. There's a couple of reasons for that. Most common is that actually we like to think that donkeys ending up at post-mortem are going to be the older ones. And as you'll see later on, there is a correlation between the incidence and severity of dental disease, and that increases in line with increasing age. But the one thing that you must take away is that just because there's a high incidence of dental disease, it doesn't mean that it's acceptable. So thinking about one of the first points, that donkeys don't get dentistry in the wild. Well, if we can think about comparing the wild to the situations that we now have donkeys in, donkeys evolved for sort of 55, 65 million years to live in Africa and Asia. This presentation, I know we've got people from overseas, but this specific part is more directly directed towards the UK. They've only been in the UK for less than 2,000 years. We know that dental evolution takes millions of years. So 55, 65 million years ago, the donkey was eating really, really soft, like almost like salad-like material. And now their teeth have changed to manage things that they would typically get in Africa and Asia: sparse, real coarse, long, fibrous material. In the wild, they would walk around 15 kilometers a day. But in our sort of domestic settings, we have to enclose their paddock turnout because we have little parcels of land that we have to manage as best we can. We have to make sure that they've got grazing throughout the year. And of course, in some countries, we would enclose the paddocks to protect them against predators. In the wild, they would graze or browse preferentially for about 16 hours a day, and that would be a range of short and long-stemmed coarse fibre. Typically in the UK, we generally give them ad lib fibre, straw usually, if they've got good teeth, or maybe hay. Plus in some instances, people tend to like to feed equids, particularly donkeys. So they would get a bucket of feed, maybe even if it's just a balancer. Feeds have evolved quite a lot over the years. So specific donkey diets don't tend to be loaded with molasses. Traditionally, sort of processed diets always were coated in molasses. But we do like to give them ginger biscuits and polos and jam sandwiches and Mars bars and treacle and all these other really nutritionally dense foods. In the wild, not many donkeys died from old age. They were usually prey victims, or they fell victim to disease. And yet in the UK, a lot of our donkeys live well into their late 20s, 30s and beyond in some instances. So we're going to look at some video clips now, and Dr. Rucker very kindly gave his permission for me to show these. If you would like to see more of this sort of content, this is the DVD you need to look out for. And there are also, if there are any dental professionals watching, there is also a series more relevant to treatment. So the differences between human teeth and equid teeth. Human teeth are brachydont or short crowned, and equid teeth are hypsodont or long crowned. So if we look at the physical size of the tooth, the very top part where it says crown, that's the only bit that you can see above the gum here. All the rest of this tooth is held in reserve within the skull, makes up the bulk of the weight of the skull. when we look at a human tooth, it's about a 50-50 split between the crown and the root. Also, human teeth are made up of, like, there's a ball of pulp tissue, that's the innervation of the tooth, the nerve center, that's wrapped in dentine and then covered completely by enamel. And when we have breaches of the enamel, so when our dentine is exposed, that's where we can get dental pain from. Horses and donkeys, the three most common dental tissues, cementum, dentine, enamel, they're all exposed on the chewing surface all at the same time, which of course would have given humans dental pain. Doesn't work quite the same in equids. And the hypstodont teeth are laminated. It gives them this kind of, because of the densities of the different tissues, they wear at different rates, and then you get this sort of undulating, self-sharpening kind of mechanism. But we'll look at the chewing in a little later. Eruption of the teeth. So donkeys have a finite amount of crown. It's about 100 mils in length, and that's designed to last in their lifetime. And it migrates through the skull, roughly towards the chewing surface, at roughly the same rate at which it's worn away. Now, as we get more towards the root sections, there's less enamel content, there's more cement. So when wear exceeds the amount of tooth available, the teeth become really smooth, as is kind of demonstrated here. When teeth become smooth, they become less efficient at being able to chew. If there's a mismatch in apposition of the tooth, the unopposed part or whole tooth will carry on erupting. This becomes a dental overgrowth. Now, the three main tissues, cementum, dentine, and enamel, they are all harder than bone. So to some degree, any dental overgrowth has the potential to erupt through bone, be a terminal overgrowth. So this is a donkey skull. It's been prepared here. We can see these teeth at the front. These are the incisors, 6 at the top, 6 at the bottom. Now, this donkey is quite young. I know that because not all of the chewing surface of this tooth is in wear. And also, we can see these bumps. These are called eruption bumps. And this is the mandible remodeling to accommodate the length of these tooth roots here. Literally, they go from the level of the opposing teeth all the way down to the bottom of the mandible there. You see this tooth here, the front and the back tooth, their roots are kind of diametrically opposed, and that's designed so that when the teeth erupt over time, they always erupt in tight compression, so that all 6 teeth operate as one functional grinding unit. So we've got the incisors. These are the ones that pull the toggles off your zips. These are what opens feed room doors and gates and everything they're not supposed to, but actually they've evolved to shear off grass at ground level. After the incisors, we've got the canine teeth. I suspect that this donkey was possibly a mare, a female donkey, because her canine teeth are really, really small here. I think this donkey was probably about 5 years of age. Canine teeth erupt between 4 and 5. I'd expect this to be a bit further on, to be honest. Canine teeth in donkeys are less sexually dimorphic, so that means that more females present with canine teeth compared to horses. Typically, canine teeth you associate with males, but a lot more. I think in horses, something like 20% of females have canine teeth, and a lot more donkey females. This little tooth tucked away here, this is a wolf tooth. Donkeys, it's really common to find them on the lower arcades. Those of you who've got riding horses, you may kind of recognise these as the teeth that you typically may have had extracted when your horse was first being broken in to ride or drive. When we look at the side of this skull, we can see the chewing surface here of the cheek teeth. It's got this really beautiful curve to it. This is completely normal donkey anatomy. This shouldn't be corrected. This is the curve of Spee. if you can imagine, if we could open the mouth, so there'd be a bit of a gap here, if we looked towards the back of the mouth, you would quite commonly see the chewing surface of the last tooth here, and that's completely normal in ponies particularly, and donkeys. We've got the 6 cheek teeth here, so the first 3 are called premolars. These have deciduous precursors, so these would have milk teeth, as with the incisors. The last 3 molars don't have milk teeth. You can see the roots of these molars are housed in this big dark space here. And this area of the skull is the maxillary sinus of the donkey. So if your donkey is unfortunate to get a tooth root infection in any of these 3 caudal or towards the back cheek teeth, it could quite easily result in a dental sinusitis. If I can draw a line from the very back edge of these last teeth straight up, it reaches the level of the front of the eye. And this is consistent over their lifetime. So when a donkey foal is born, the back of their cheek teeth is in line with the front of their eye. How can that be when their skull is like this big? Well, they just have less teeth. So when they're under the age of about 1, all they have is these 3 molars per cheek teeth row. So they would have each for each quadrant of the mouth would have these 3 teeth. I think that's all about that one. Right. There we go. Right. Donkeys, or all equids, are known as anasygnathic. That means there is a discrepancy between the width of their top jaw and their bottom jaw. In donkeys, the top jaw is about 30% wider than their bottom jaw. And in horses, it's about a 23% difference. So that leaves the inner third of the maxillary cheek teeth kind of overhanging the outside half, or the lateral half, of the mandibular teeth. So being anasygnathic in conjunction with hypsodont teeth, or long crown teeth that erupt over time, and having a sideways chewing stroke, leaves them with an angulation on their chewing surface. It says here 15 degrees, that's actually an average. It ranges from about 9 to 20 degrees in the same cheek teeth row and be normal. And the self-sharpening mechanism of the teeth being all different tissues wearing at different rates, we end up with these sharp edges. This is dental treatment in a nutshell. These sharp edges on the outside of the upper cheek teeth and on the inside of the lower cheek teeth. So this is a really good animation of how equids typically chew. And you can really get a good impression of the roughness, the texture of the chewing surface, grinding over the opposing teeth and crushing the long-stemmed, coarse ingesta down into particles for swallowing. Now, the velocity or the speed of the chewing stroke comes at the first 3 cheek teeth, the premolars, and at the last 3 cheek teeth, that's where the compressive force comes from, particularly the very last lower molar, the lower 11s. So much so that over time, when donkeys start to wear their teeth and the amount of visible crown is reduced, if the lower 11, or the last cheek tooth on the bottom, on the mandible, is affected, that can reduce the amount of compression that they are able, it affects the efficiency of their chewing. Oh, I'll just play that again. So they chew about 55 times a minute, or 40 to 50,000 times a day, and that's impacted by the food that we're able to give them. So if we're giving them short-stemmed food, or processed diets, they don't have to put in hardly any effort, and the kind of makeup of the food that they're getting isn't applying much in the way of wear to the crowns. Chewing force is thought to be around 800 to 900 newtons on average. Maximally, it's about 1700. And compare that to humans, where the average force is between 70 and 150 newtons, and maximally is about 500 to 700. So we touched on earlier the implications of domestication. We have very little choice other than to restrict grazing, because we have to manage it. The grazing that we have got is really nutritionally dense. So if we're trying to manage our donkey's body weight, we have to restrict grazing to some extent. And the shorter stemmed feedstuffs, as I've just said in the previous slide, places little wear on the teeth and reduces the amount of lateral excursion, or amount of sideways movement that the jaw has to make. And all of these things combined accelerates the development of sharp teeth. And if there are any partially unopposed teeth, it accelerates the development of overgrowth.
Hey, Gemma, we have a question here. Do donkeys in the wild suffer from similar dental issues to those in captivity? Do they get sharp edges and uneven wear too?
Yeah, it hasn't been researched exclusively in donkeys, but it was researched in a population mainly of horses, but it included some donkeys too. And yeah, they do. They suffer exactly the same. So we used to think, oh, well, donkeys need more dental care in captivity because we can't match the rate of wear on their teeth with the feedstuffs that we give them, when actually donkeys fed a natural diet also suffer the same kind of things. In the wild, donkeys would die from dental disease. If they had, we said about dental tissues are harder than bone. So if they had a dental overgrowth, it would just carry on, penetrate through the opposing structures and would ultimately kill them.
Oh, okay.
Is there any other questions?
Is it a bit of a design fault then that they have a narrower bottom jaw than a top jaw?
Ooh, a design fault. I don't know. I think they've probably evolved to be how they are. I don't know that it's a fault per se.
Maybe you need some time to think about that, and there's a new research project in the offing there.
Yeah. Okay, so we've done quite a lot of research at the Donkey Sanctuary, and we know that dental disease, particularly in the UK, is correlated to colic, particularly impaction colic, which carries a high fatality rate in donkeys. Dental disease increases in prevalence and severity in line with increasing age. Obesity and emaciation, hypolipemia, sinusitis, as we saw with the last three cheek teeth, the roots or the apices being housed within the maxillary sinus, and mortality. But what kind of dental diseases are we talking about? Well, this is some research from quite a big PhD project, and we can see along the top here we've got ages, different age groups, and the prevalence of disease. You can see in line with increasing age, you see increasing prevalence, with the exception of enamel points. And why is that? Because there's less enamel content in the root section of the teeth. So as donkeys get older, they get, their teeth become more smooth instead of more sharp. That doesn't mean that they need less dental examinations or treatment, because they get a plethora of other diseases. Wave mouth, step mouth are all types of overgrowths, and we can see that they increase in prevalence with age. But we know that 90–95% of donkeys are born with good teeth, and the fact that dental disease gets worse as they get older kind of suggests if some of the diseases they're being affected by, things like overgrowths, which are preventable, then why aren't we just seeing them sooner or more often, or whatever it takes, so that we haven't got these horrific levels of dental disease in our donkeys? So why is it? I had a message over Facebook in response to this webinar to ask, why don't people just get their donkey's teeth done the same as horses? I thought that was obvious. Well, maybe they do. But we know that donkeys are born with good teeth, and yet they end up with sort of 80% of them end up with bad teeth. So what is going wrong in between? So we're going to look at some pictures of dental disease. But firstly, we're going to have a look at what a normal mouth looks like. I'll just get my laser pointer. So this is probably the most normal donkey I've ever seen. It was a young donkey in India. Firstly, we can see that these teeth are in beautiful alignment. We can see the variation in the angle of the chewing surface. So here it starts off fairly flat and then increases, and then at the back it either gets steeper still, or, as in this case, flattens out, and we can see the chewing surface of the last tooth. If we look at what's happening upstairs, this is a really nice little discrete wolf tooth there. We can see all these colours on the chewing surface, and these are all the different dental tissues. So this lovely white scalloped edging, this is the enamel. These are where the enamel points come from. And you can see we've got this donkey's mouth open, but you can see those sharp points are actually in contact with the soft tissue there. These dark spots, this is secondary dentine. So in human dental anatomy, we've got this ball of pulp tissue, the living tissue within the tooth. When donkeys are very young, the tooth first develops, they do have one common pulp chamber, and from that chamber emanates these projections towards the chewing surface. They recede over time, because if they didn't, through normal wear, they would become exposed, and that would be really, really painful, and it would predispose the tooth to infection. So what happens is, as these pulp horns recede, they get backfilled with secondary dentine, and secondary dentine takes on food staining a bit more readily than some of the other tissues. That's why it's dark brown. We can use that as a measure of a bit of a safety net of how much tissue we can reduce in a tooth. So the pulp recedes in accordance to dental wear. If you have a dental overgrowth, by definition, it's kind of think of it as an underwear as opposed to an overgrowth. So you can't ever tell how much signal that tooth has had and how much the pulp horns have receded by, but we can use this as a measure. So by reducing the tooth, we see this dark staining go a bit paler. We still need to see this on the surface. So if people are reducing teeth so they're all one colour, that can be an indirect exposure of the pulp tissues. You can irritate the tissues around in the pulp. What else have we got? Look at the discrepancy in the width of the maxillary cheek teeth compared to the mandibular. These are about 1/3 wider. Why is that? Because they've got these, you see these lovely pairs of yellow, this is cement on the chewing surface, and that's surrounded by enamel, and these are called infundibulum, and they're like a blind-ended funnel, if you like, and they're filled, or should be filled, with dental cementum. If there's an interruption in that filling, then food can get into the cavity, into the space up there, and degrade, and they can get a condition called infundibular caries, which is a bit like dental cavities in humans. Donkeys don't tend to suffer as much as horses. It's something like 50% almost of the horse population suffer with a degree of infundibular caries, but the sort of teeth that are affected in donkeys are the same. So it's usually this first cheek tooth, the 6, and then the number 9 at the back. And histology has shown that these are the teeth that for some reason have the least grossly normal cemental filling. Oh yeah, we can see that the teeth have got these ridges on, and they go across the teeth. These are transverse ridges. They're completely normal, and they increase the surface area of the tooth for one, but also they marry up with the ridges on the palate there. Now, if you put your tongue behind your incisors and feel your palate, you will feel that you have got the same ridges. In equids, these are designed to help take the bolus of food, so they chew, form a ball of food. If they spit it out at that point, that's quidding, but ideally they won't spit it out because they've got good teeth. The ridges act as an escalator just to help to continually drive the food back for swallowing.
Gemma, just before we get into this exciting photo, can I just quick couple of questions that just to clarify? Mandy's asked, if donkeys' teeth differ from horses, do mules differ too?
It's not been studied, to be honest. Anecdotally, I notice more things like the picture that's up at the minute. I see more of this in mules than donkeys per se.
Okay.
Yeah, it's not been formally studied in any way, really.
There's a second research project there. And Nikki's asked, can wolf teeth appear just at the back of the front teeth or more towards the premolars?
They can, if they're abnormally positioned, they can appear anywhere. But their typical position is right in front of this first cheek tooth. Sometimes they don't break through the gum, and they can actually erupt along the bone instead of down from it. So they can be a bit more forward positioned. You could get instances where donkeys have more than one wolf tooth in any quadrant of their mouth. Sometimes they're tucked right round the side of this tooth. So yeah, normally they should be up against this tooth, but there is the potential that they can be displaced.
Brilliant. Okay, thank you.
Okay, so this donkey, I think he was about 10 years of age. So the eruption rate, the rate at which the tooth migrates through the skull, and the same rate at which it's worn away, is anywhere between 2 and 4 millimeters per year. So this was a 10-year-old donkey. I mean, these are upper cheek teeth, so they've got gravity on their side, but it's likely that he always had this overgrowth, not to this height, obviously. The speculum on this donkey, or the gag, is open as far as it will go, and we can see this, the terminal end of these overgrowth. If that gag was shut, you would see that actually these are starting to ulcerate the opposing soft tissue. Another 4 millimeters, it'd be eroding into this bone. Other things we can see, this creamy coloured tissue here, this is calculus or tartar, and it usually develops because of the proximity, or usually develops at the proximity of a salivary gland duct. So the other side of this tooth, if you could pull this cheek away about this level, there would be a salivary duct, and it calcifies the plaque that has the propensity to be calcified. So for those of you who would prefer not to see post-mortem images, look away now, and I will try really hard to remind you when to look back. Okay. So we just talked about dental calculus. We can never underestimate the capacity for calculus to cause significant trauma. So this donkey had calculus caked all over her cheek teeth. This part here actually fell off just before the picture was taken, but it's this is her cheek. Her cheek's been turned inside out, essentially. All this soft tissue had been eroded. It takes a little while for plaque to calcify and keep calcified. You can just see it here in kind of layers. So this is years of not having adequate dental care. The other thing to bear in mind is that calculus, when it becomes dislodged, can be really, really sharp. So if your donkey is unfortunate enough to swallow this, it can lacerate them from the inside. So, as I said, dental overgrowth. Sorry?
I was just saying they can look back now. You've taken the graphic picture away for them.
Oh, well done. Yeah, I forgot. Sorry. Dental overgrowth might perforate the opposing structures, and the prognosis is usually quite poor. Some of the other dental conditions that we saw on that PhD data are dental displacements, loose teeth. Now, the ligament holding the tooth in the socket has got about 28,000 fibres per millimetre square. Some of those fibres are nerve fibres. So when we start to see disease processes that, such as periodontal disease, which means perio is round and dental is tooth, so like gum disease, escalating levels of gum disease that can affect that ligament, then loose teeth are really, really painful. And, these donkeys suffering from dental pain should be adequately managed. Caries, we don't tend to see a terrific amount of infundibular caries in donkeys, but we do see more commonly peripheral caries, and I'll show you that in a little while. Periodontal disease is a big problem for donkeys, and we'll talk about that a little bit later on as well. And yet in the countries that they've evolved to live in, periodontal disease is so far less common. So dental displacements, I'll get my laser, there it is. We see these cheek teeth ideally in a picture of our normal donkey. These were all in nice alignment. We can see this one very, very obviously displaced out into the cheek. And these can cause really quite nasty ulcerations. And ideally, when they're this displaced, they are best extracted. When they are like this, sometimes they're not sort of displaced like that. Actually, the teeth are almost bent, which can make extracting them really difficult. This is an endoscopic view. So the endoscope is just a camera on a long stick. And we can see this is the cheek, this is the tongue. One thing we can see in both pictures, this donkey where the laser pointer is now, she's had her mouth washed, and yet still we've got these fibres stuck in between, and we've got some fibres stuck here. So what happens in periodontal disease is food becomes static for some reason. There's a dental displacement, for example. The food becomes static and putrefies, and the gum recedes. So more food gets stuck, and the gum recedes even more. And this eats away eventually at the periodontal ligament until the teeth become loose, and even beyond that, till the teeth become exfoliated, because there's nothing to hold them in. And this is a really painful disease process. So dental overgrowth can be so profound that they perforate the opposing structures. This mare was about 12 or so, and you can see this like black pitted, almost like tar, stuck on the inside edge of these teeth. That's peripheral caries, so it's caries that works from the outside in, as opposed to infundibular caries that works from the inside out. Far more common in donkeys. We've got the gag open as much as we can, and we can't yet see the end of this overgrowth. It was absolutely enormous. Generally, in donkeys, their upper jaw, the maxilla, doesn't move. The mandible moves for chewing. Because it's fixed at the symphysis, or at the chin, essentially. Usually what happens on one side of the mouth is kind of mirrored on the other side, but not so in this donkey. And this is really, really advanced. She's also got a degree of shear mouth, so that's a sheer or very steep angulation of the chewing surface when you compare it to her what we assume to be normalish side. So why has she got this overgrowth or underwear of these teeth? Well, if we take a look at her x-ray, this is a lateral view of an x-ray, so there's a lot of superimposition of the different structures, but basically I'm sure you know, but the bright white things are usually bone or teeth. So we've got her incisors here, got her cheek teeth, and you can see here is the overgrown 2 teeth, big overgrowth here. We can also see something that looks like a tooth right at the bottom of her jaw, and it was a tooth lying horizontally. All this kind of fluffy stuff here, this is cement, so the softest of the 3 dental tissues. So it wasn't providing sufficient wear for these teeth. Those teeth just over-erupted straight through into the mandible. And if I go back to the view of her mouth, what do people think were the clinical signs for this donkey? She got a big overgrowth, trying to chew with 50,000 times a day with those teeth, boring a hole into her jaw, big infection. This donkey never dropped any feed. She didn't quid. She ate continuously. And if any of you have seen the Donkey Sanctuary Body Condition Score sheet, it goes from 1 to 5. So 1 is very underweight and 5 is very obese. Being kind to her, she was a 5. So, you know, donkeys aren't particularly well, I guess they're not as demonstrative as horses when it comes to dental signs of discomfort and pain and whatever else. Okay, so we've got some more graphic pictures coming up next. Please look away, and I'm sure Ben will remind you to look back. This is a donkey, again at post-mortem. She's got multiple conditions. So she's got diastema, which are gaps between the teeth that shouldn't be there. So where we've got those teeth erupting as one single unit, can be a number of reasons why she would get a gap. Maybe one of those transverse ridges from the teeth above has overgrown and forced them apart. Maybe she's had escalating levels of gum disease and food stasis. We've got this tooth here that seems to have been very worn, almost impacted. And if we follow the line of the chewing surface or the occlusal bite, we can see it's a bit wavy. And we've got this overgrowth at the back, which I guess if you took this tooth to be relatively normal in height, this overgrowth would be probably twice the height of a normal tooth. Now, when we look, keep looking away if you don't want to see these pictures, we look at her opposing jaw, so her nose would be down here, ears would be back here. These are 2 holes made from those overgrowths of those lower cheek teeth. If you remember back to the picture of the skull of the donkey, we know that opposing, I mean, she's missing 2 teeth here, but we know the roots of the last 3 cheek teeth are housed within the maxillary sinus. So these holes being made by the lower teeth, they were penetrating through her sinus. So everything she was eating, as you can see here, was getting chewed up and pushed into her sinus. Right, you can look back now, I remembered. Dental fractures. This is quite a common presentation, and it's more common in young Irish male donkeys. Why would that be? Being youngsters, they like to play with their friends, games which means that they might be at the back of another donkey. And if that attention isn't wanted, they get a pair of hooves in their face. And it is usually this tooth. Sometimes it's this one, but more often it's this front incisor. And you can see here, fracture line across the crown there. This is a little bit of caries from a bit of a fracture from this tooth as well. Because of the arrangement of the dental tissues in incisor teeth, the fracture line at the front of this tooth here is obviously here, but behind that, the fracture line will be higher up. So usually dental fractures of incisors are almost wedge-shaped. If we look at the same donkey about 18 months on, we can see that this crown is very, very nearly in occlusion, perfectly healthy, and it looks really good. Even this section here that had a bit of a caries. Right. Most dental service providers, they get taught to draw an imaginary line down the front of their patients to check for symmetry. I think when you do that on this donkey, it becomes more obvious that we've got this whacking great big lump here and a very normal looking face on the opposite side. When we look inside his mouth and on x-ray, we can see, if you can remember back to that, the mouth of the normal donkey, all the different colours of the teeth. Well, actually, 3/4 of this tooth is actually one colour. There's some little bits of what looks like normal-ish tissue, and we've got a bit of a fissure here or a fracture line. So these teeth are dysplastic, so there's been some sort of abnormality with the formation of them. This was just cement. This was quite a young donkey, so his opposing teeth, you can see on the x-ray, they're overgrown a bit, but not terrifically yet. If we count the crowns, there should be 6. We've got 1, 2, 3, 4, 5. Yet orally, or in his mouth, he had 6 occlusal surfaces. So there was some amalgamation of what looked like semi-dental structures here. All this sort of cloudiness is cement. And we can see these little circles. He's got one in there as well. Those are little pearls of cement just there. And one of the signs that this donkey had a problem was that, you can't quite see it very well on here, but the nasolacrimal duct, so it goes from the corner of the eye and takes their tears all the way out and deposits them out of their nose. Because of the distortion of his face, that was compressing the nasolacrimal duct, and he was getting a lot of tearing down his face. Other than that, he was eating normally and behaving normally. Another very beautiful donkey, this. If you draw an imaginary line down the front of her face, we can see the curvature of her face here, and this side, it ends a bit more towards her nose. And we look inside her mouth, and it's a bit of a dental car crash. So this is her wolf tooth here. It looks kind of grey and a bit gnarly. It's probably suffered a degree of resorption or fracture. A horrific shear mouth here, so a real severe angulation of the chewing surface. This was actually quite a hole between these teeth that was filling with feed. She actually got an extra tooth, supernumerary tooth, that was causing her problems, and she ended up losing these 3 teeth. So,
Gemma, can I just ask another question? Steve's asked, if as a tooth erupts, what, if anything, fills the cavity behind the tooth?
Oh, good one. The skull constantly remodels to backfill the gap left from where the teeth were. So if you've got some young donkeys and you can feel each side of their mandible, the youngsters will be really, really thick because they've got full cheek teeth in reserve in the skull. And if you feel the thickness of the mandible of an older donkey, it's much, much thinner because the teeth have erupted, and yeah, it's just bone that backfills the gap.
Cool, thank you.
That's okay. So here we've got a really nice little female donkey. This is actually her son behind. And what do you think of her body condition? I mean, we can see a bit of fat deposition on her son. You can see a little bit on her neck, but, you know, her bottom's round, but, you know, it's neither pointy, it's not obese. I mean, on the Donkey Sanctuary scale, if you put her somewhere in the middle, just by looking at the picture, not by putting your hands on, you'd think that, you know, yeah, about the middle, 3-ish, would be about right. So when we think of dental disease being correlated to body condition, this was the state of her mouth. So she's got a marked sheer mouth on her right-hand side, lots and lots of food stasis on her left-hand side, which is probably the side that she eats more on. We can see green stripy teeth, little humbug teeth. Those are diastemas, so those are gaps between the teeth that are allowing grass or whatever else she's eating. I found all sorts, electrical cabling and all sorts of things in donkeys' mouths. That just becomes static in there. I've got a small displacement here out into the cheek, and we can see these really steep, sheer lower cheek teeth here, lots of plaque. These teeth were so loose that when I put my hand in, they fell out. But you can see the degree to which they're causing the tongue to deviate here. So using body condition score as your measure of dental function can be quite flawed. Right, some more graphic pictures, so look away now. So we talked about the last donkey having green stripy teeth, and here this is a close-up of a donkey with a diastema. We can see that this tooth is tipped towards the inside or the medial side, and all this food material has become stuck in there. And of course, they can't pull it out themselves once it gets really wedged in there. And this is what caused the escalating levels of gum disease. We've also got another little one here, and we're missing a bit of cement on this tooth. If we can catch dental displacements in young donkeys,
Okay, Gemma seems to have frozen.
this creamy coloured stuff, this is pus. This is dental infection oozing out of this donkey's head. She has diastema at every single tooth. Look at the colour of the gum here. I mean, okay, this is a donkey at post-mortem, but you know, the colour of her other mucosa is fairly normal. But look at this; it's really grey and dark and necrotic. So this donkey had a profound infection. Keep looking away. Okay, so imagine chewing for 40 or 50,000 times a day with a piece of wood chip stuck in your teeth. It's caused an enormous ulceration, well, laceration to the tongue and trauma to the cheek. As donkeys get older, their teeth start to narrow towards the apices, towards the roots, so you can get an age-related diastema. Sometimes they occur in the absence of other disease, so it's a bit of a catch-22 whether you treat a diastema that has no disease associated with it. Well, when you leave it and then you get wood chips stuck in it, But, I mean, these are relatively uncommon cases. You can see on this tooth as well, this is mainly cement. So this is quite an old donkey, and she's getting towards the root sections of her teeth. Right, you can look back now if you're looking away. This is a donkey with profound shear mouth. It was likely to have been a defect from birth. We can tell that from it's almost like a collapse in his palate. Really, really ultra severe. Probably only eating on his left-hand side. This was a donkey I saw. It had been treated just, I think it was 2 weeks before I saw it. I just happened to see it given a workshop, and the owner presented me with her dental chart that unfortunately she'd used somebody that wasn't qualified, and this donkey had received a comfort float, but I can't imagine chewing with this real sharp point here 50,000 times a day very comfortable. And if you can see the distortion, this sort of lump on the side of the tongue here, this was a penetrating injury to the tongue, and it's actually filled with feed. This is quite a common presentation in particularly miniature donkeys. I know there was a few people joining the webinar with miniature donkeys. So medial or towards the midline overgrowth of the last upper cheek teeth is fairly common in mini donks. This was another donkey treated by an unqualified dental technician for actually all of her life. We've talked about dental overgrowth actually being preventable. So quite why she has these overgrowths, I don't know. Multiple displacements. I think all 4 of these teeth were really, really loose. She had some quite marked other systemic conditions. And unfortunately, it was deemed for this particular donkey that it wasn't fair to put her through not only the extraction of all 4 of these teeth, but also the aftercare with all the other sort of life-limiting problems that she had. The rest of her mouth obviously looked in a similar fashion. And the changes that we would have to make to try to help her manage with life, it was deemed that she was actually better off being put to sleep. So we know then that there's an element of quality of life associated with dentistry and dental disease. Actually, half of all donkeys with severe or very severe dental disease end up being euthanized within 3 years of being declared that they have severe or very severe disease. We've looked at the impact that cheek tooth loss has on longevity of our donkeys, and we found that generally these are just trends, they're not sort of exclusive statements. So generally, when donkeys have lost about 5 of their cheek teeth, they are euthanized within a year, and when they've lost about 10 cheek teeth, they are euthanized generally within 6 months. We said before about this confusing relationship between dental function and body condition, but actually when we're able to map body weight retrospectively over time and match that to dental disease, we can see that as function starts to decline, body weight also starts to decline, but it's really small amounts over a long period of time. Not too surprisingly, the higher number of functional cheek teeth, the longer donkeys live for. We also looked at how the donkeys, what conditions led to the donkeys being euthanized, and most of the colic cases began when donkeys lost 5 or more cheek teeth. Every single donkey that lost exactly 8 cheek teeth was put to sleep because of impaction colic. So the loss of 8 cheek teeth represents a 33% loss of function of the mouth. And these donkeys all had multiple cheek tooth loss adjacent teeth. So when teeth were dotted about the mouth, teeth loss was dotted about the mouth, they tended to live for a bit longer. So if donkeys, if we can't read the signs, if donkeys aren't particularly over enthusiastic about showing us that they've got dental disease, what exactly can we look out for? Well, if we think of the mouth as the start of a processing plant, it kind of makes sense that we might be able to look at the other end, what comes out of the processing plant, for clues as to the efficiency of the start of the processing plant. If we can see this tongue on the left-hand side, I think you'd all agree this is pretty normal. As for fibre length, we can't really tell. It all looks pretty uniform, to be honest. We've got odd individual areas of long fibre, but generally, on the whole, it's all pretty uniform. When we look at this on the right-hand side, you can immediately see the problem. All these long, really long fibre lengths. And it's not just 1 or 2, it's the bulk of the pile. So we had a dental science undergrad come and do her dissertation at the sanctuary, and she was looking at pre and post dental treatment fecal fibre lengths, not only to ascertain the effectiveness of dental treatment on donkeys, but to see if we could use fecal fibre length as a marker of disease. So in the horse literature, anything over 3.6 millimetres indicates the development of dental disease, and our group of donkeys had a fecal fibre length of 4.37 mils, and that indicates serious dental problems. And that's certainly what we found when they opened their mouths. Their ages were between 5 and 10 years of age, and we saw things like diastemas and overgrowth and periodontal disease, and that was clearly affecting the efficiency of their mouth. After they'd all received dental treatment, the fecal fibre lengths reduced, and they did an initial reduction, and then after 2 weeks, then they reduced some more to this final level of just under 2 millimetres. Okay, so this was in response to a request from somebody on Facebook. Treatment considerations. Donkeys are different. You have to, as a dental professional, you have to switch out of horse mode and just chill out and relax. Generally, you don't need more than one person helping you. Donkeys do not need squashing, tying down, strapping down, trapping between gates, forcing against walls, etc. Donkeys are actually quite sensitive emotionally, and I think if you go in with this kind of battle mindset, then you're going to end up with a battle. And yeah, we know that donkeys bond closely to each other, so keep their bonded friend close by. Logistically, actually most contemporary instrumentation fits most standard and almost mammoth donkeys. It fits them all. The difference comes, miniature donkeys sometimes need a bit more of a special focus when it comes to instrumentation. Most donkeys actually tolerate unsedated dental work really, really well. And by tolerate, I don't mean you're able to get it done, but it was a struggle. I mean, they will relax and allow you to perform a really good and thorough dental examination and subsequent treatment. And actually, a lot of unsedated donkeys will use the headrest that we typically use with sedated horses, but many donkeys will relax onto a headstand. So, to conclude, hopefully you'll agree that dentistry plays a really key role in the management of health and welfare of donkeys, and has effects on their quality of life. Dental conditions can become so severe that they're irreversible or untreatable. And quality of life assessments should be considered, keeping our welfare markers in mind. Some oral pathology is considered the most painful conditions of the donkey. And I think basing entitlement to treatment on a perceived value is ethically questionable. So when we hear that people say, oh, it's only an old donkey, doesn't need its teeth doing, why not? They're just as kind of entitled to get good quality treatment as a £5 million racehorse. They're still entitled to good welfare. Right. Any questions?
Yeah, Gemma, there are questions. Are you ready?
Okay.
So, little question about miniature donkeys. Do they have the same, as many teeth as the standard sort of donkey? And are the teeth
the good one size? Usually, well-bred miniature donkeys have the normal amount of teeth. In terms of physical size, they are the same, proportionally the same size teeth as standard donkeys. So when you get people trying to achieve miniaturization in a few generations, you can get this discrepancy between the size of the jaw and the room for the teeth to erupt. So sometimes you get teeth absent in miniature donkeys. That's great if all 4 opposing teeth are missing, and the teeth erupt normally and meet normally. But usually what happens is you have maybe 1 tooth on the upper arcade is missing, a few teeth on the lower arcades are all distorted or displaced. So it can go quite awry for mini donkeys. So yeah, you definitely need to keep them in with regular dental assessments.
Which is great. You use the word regular there, because a couple of people are asking about the schedule. How often should you have your donkey's teeth looked at?
It depends on the dental health that they've got at that moment in time, and it can depend on how old they are. So teeth become, in younger donkeys, teeth can become sharp within a few months. Doesn't necessarily mean that they need treating 3 or 4 times a year. You might be able to manage them, if they've got good, normal, healthy teeth like the donkey from India. You can usually manage them on a 6 to 12 monthly basis, but definitely go with whoever you get to come and do your donkey's teeth. Ask them, because it will be individual. It might be, if you've got 10 donkeys, 3 of them might need every 3 months, 1 might need every year. It's so individual.
Good.
But generally, as a rule, between 6 and 12 months.
And how old should a foal be when for their first dental visit?
I think there's no harm in checking them as soon as. Definitely, you want to know if there's any kind of developmental problems. You need to know as early as possible, because if surgical intervention is a road that you might wish to go down, there is a window for that. And also, you might want to know if you've got a donkey that's severely parrot-mouthed, or they brachygnathic, so the top jaw it overlaps the bottom jaw. That's going to affect how they can suckle. So you're going to want to know that as soon as possible. So yeah, I mean, if I'm on a yard and there happens to be a foal, I will always just assess them. You don't have to charge.
Okay, good. Let's have a little check here then, which is about how do we go about finding a dental qualified person to examine rescue donkeys? Do we ask the vet, question mark? And if we cannot find an equine dentist in our area, are there ways we can ensure an equine vet is qualified to treat the donkey?
Ooh, cool. Is this, can you tell if this person is from the UK or overseas?
I bet they're about to tell me. Roxana and Derek. I'm sure we'll tell it. Oh, from Texas. Roxana's actually from Texas. So yeah, if there's an equine dentist in the area, if there isn't one, can you tell whether the vet is qualified? And Derek's from Scotland. So he's asking about how to find a dental person.
Right. So in the UK, obviously I'm more familiar with the situation in the UK, but there are two groups of qualified dental technicians. There's the British Association of Dental Technicians, which is the one that I'm a member of, and there's the Worldwide Association of Equine Dentistry. You can go to both those associations. They've got websites with membership lists. All of the BAEDT members are qualified. On the worldwide page, you have to look for the category 2 qualified members there. And vets can join. We've got a lot of vet members in the BAEDT. So if you prefer your dental treatment to be applied by the vet, then we've got a lot of members. In America, it's slightly different. There's a couple of really good dental training schools there. Their system can slightly be abused in that you can go for 2 weeks or 6 weeks, however long it is, and never go back. It seems a bit ridiculous that you can have someone coming and performing work in your animals with as little as 2 weeks training, but that's the situation. So it would be worth contacting those schools. There's one at Idaho. I can't remember where the other one is. But yeah, have a Google about and ask the schools for a list. In the UK, we've done some training with dental technicians, specifically on donkeys. So, you know, if it is possible in the UK to find somebody who's had additional training. It's not required. Anybody who's qualified in horses would be qualified in donkeys. Should you use your vet? Yeah, your best bet is to have a look on their website, see what their specialisms are, see if they've attained any qualifications. Most people, it will be on their websites, it will be on their marketing information that they've attained additional qualifications. And if not, it might be a case of ringing and asking, to be honest.
Oh, there we go. Sorry, I'm back. Roxana is really happy with that. I'm trying to take this logically through, everybody, the questions. So the next one is about what do you think about sedating and painkillers before, during, and after treatment?
Definitely. Donkeys feel pain as much as people do, so why wouldn't we give them pain relief if you can manage? You know, if you're going to be doing something painful, if you're going to be like extracting wolf teeth, for example, it's humane to be sedating them and to be giving them adequate analgesia for these procedures before, during, and after. There's aftercare. It all needs to be pain-free. It's like a legal requirement that, you know, you're managing pain in your animals. And yeah, sedation is a fabulous tool. I mean, you know, if your donkey is not in a place in his training that allows for you know, a non-traumatic dental visit, get them sedated. There's loads of sedatives there's IV into the vein, there's intramuscular, there are oral sedatives that your vet can leave you, and you can administer sort of 40 minutes before either your vet or your dental technician comes to perform the work, and they're so useful. But yeah, there's dentistry shouldn't be traumatic, like emotionally or in a pain sense at all.
Good, good. I think that's pretty clear. And that brings in a little question I think I might be involved in answering here for you, Gemma, is about my vet will only carry out dental checks once sedated. My mini donkey hates injections. I'm dreading him get his teeth done for the first time. Any tips? Yeah, you need to watch the webinar that we did for behavior last week when we get that put up, because we talked lots about preparing your donkey for the vet, Nikki, and especially injections and stuff like that. So maybe if you want to contact me outside the webinar, we can talk about that shaping plan that you could put in place, get your donkey ready to be sedated, if that's what you want to do and you want to carry on using your vet, obviously. Or I'm guessing, Gemma, you could look at that list of qualified professionals as well and see if there's somebody else that might want to come and have a look without sedation initially, if that's an option for you and you've got those choices to make, I guess.
Definitely.
Cool. Okay, good. We're getting there. Apart from, can you use a toothbrush? Jasmine asks, on your donkey's teeth.
You can, indeed. You can appreciate that the cheek teeth reach all the way back to the level of the front of the eye. So at your own risk if you want to brush them. But the incisors, of course, are really accessible. So if your donkey has some degree of gum disease around the incisors, it can be really effective if, you know, as long as it's not sort of traumatizing to them. But it can be really effective to clean their incisors, for sure. Yeah. If you're worried about the teeth looking a bit brown, well, the outer aspects of the incisors are covered in cementum, and that picks up food staining really easily. So it might be something that you can't brush off.
Okay, good. Now we're getting on to the technical questions that have come through. I just want to check here. Can anything be done for shear mouth?
Yeah, depends on the cause and the extent of it. So the really severe one that we saw earlier in the pictures, thankfully they're few and far between, and the treatment options are quite limited. So you're trying to reduce and make the donkey as comfortable as you can. When it's less severe, there's always a reason for shear mouth. So if you take a really good dental assessment, maybe using an endoscope or a mirror, and have a look for pathology on the teeth, because that's if it's happened through wear, it's usually an alteration of them chewing differently. So you need to look for signs of tooth root disease and periodontal disease. Anything that might maybe displace teeth can encourage them to alter their chewing stroke, which can alter the wear on the teeth. But yeah, at the early stages, the earlier you can address the cause, the better chance you have of correcting it.
So that goes back to our fall question and getting them early on. Just before we get to Steve's really technical questions, I'm just going to ask Roxanne from Texas has asked about we cannot get barley straw here except for bedding, which is kind of interesting, as we feed our barley straw here for bedding and for feed, but we feed Bermuda coastal grass. It's definitely softer than straw. I wonder if that changes how often he should be seen.
If they've got good teeth, then not necessarily. But yeah, you're really at the hands of whoever's coming to do your dental examinations for them to use their knowledge and experience to be able to say the next time that they want to see your animal. But yeah, I mean, the coarseness or the kind of fibrousness of food does have an impact on teeth, for sure. But it doesn't necessarily mean that they need seeing any sooner or later.
Brilliant. Yep, that's good. Okay. Steve has asked, last couple of questions here. Let me just check. A little bit of a technical question. Is the angle of feed significantly different in donkeys versus horses?
Yes.
And does it require any different floating technique or tool to preserve? Is it an art to maintain it, or are there easily readable landmarks that can serve as a guide?
Oh, cool. Right. So curve of Spee is really common in donkeys, particularly mini donkeys, also ponies. It's less common. I haven't seen mammoth jacks on like a wide scale, but they have virtually no curve of Spee, and a lot of horses don't. So to differentiate between curve of Spee and a dental overgrowth of the last lower molar, basically the distance of the erupted crown, or the visible crown you can see when you look in the mouth, should be the same height at the front and the back of that specific tooth. If you put your hand in and feel over the top of that tooth, you can get a rough estimate of the distance from the chewing surface to the ramus, which is kind of the upright portion of the mandible. Preserving that, working visualized. So if you're using motorized instruments, definitely working visualized, and just being very, very cautious not to take too much off. The temptation is to flatten it out. It's very easily done with motorized instruments. It's quite easily done with manual instruments as well, some of the more aggressive floats and blade types. If you're using motorized kit, something like an apple core burr is really nicely shaped. You can get in and out of displaced teeth, and you can like just gently roll over the lower 11 to keep, if it's in a normal height, you can keep, you know, teeth need to be tooth shaped after you've treated them. But we've got a book coming out in the next month or so, and it goes into quite some detail about things like that. So if you keep looking at our website, in particular the professional section, then you'll see when the book comes available for sale or download, I think.
Absolutely. I'm sure that will be the same as the companion, and there's some great stuff in there for everybody. It's going to be a really good resource, so we'll make sure everybody sees that. And Steve has another question: for examining my donkey's mouth without speculum, can you recommend and what might I use as something to put in their mouth to keep the jaw from closing or being bitten accidentally when reaching further in?
Yeah, I've done this sometimes when I feel, you know, if I'm just very quickly checking something in a donkey that's had a particular treatment, like say they've had a tooth out, and I want to just quickly check that they've still got a plug sealing the empty socket. And I did it. Within 1 month, I broke the end of both index fingers. So it's not a recommended technique.
I think what you're saying is get a speculum. Is that what we're saying?
Yeah, I mean, full mouth speculums are pretty reasonable in price now. It can give you an unrivaled, in terms of safety and access and visualization of the teeth and the mouth. And of course, there's way more to dentistry than just sharp teeth and overgrowth. There's a lot of disease of the soft tissues. You know, things feel a lot different sometimes to the way that they look as well. Trying to identify infundibular caries or cavities within the teeth is very hard, especially when they're at superficial levels, to do that without looking and using a mirror. So I would really recommend using a full mouth speculum. Other than breaking both your index fingers, I don't really know what else that you could use to sort of wedge the mouth open. I mean, you can sometimes, especially if I'm looking at the incisors, I might put my hand through the interdental space, just about roughly where you put the bit. You can still get a good old crush from a mouth, even though you're sort of far away from the teeth. But that might give you enough to look certainly at the incisors and maybe the first cheek tooth you know, with any degree of accuracy.
Would you also, Steve, I'm guessing Steve has, I think he's in America, New York, has some mini donkeys, because he's asking, when you work with minis, do you use a table to bring them up to your height, or do you just go down to theirs?
Yeah, I've dreamt about like mechanics inspection ramps and pits and things like that, but no, I tend to bend down to them, really, because I mean, unless you're sedating them on a platform, the additional risk that's placed by having animals elevated is probably not worth it. But that said, it depends on how successful you are in training your donkeys. But by and large, I bend down to their level, and I make sure that you're not like holding their heads right up, because it can be quite uncomfortable. I mean, elevating the head without generating a negative behavioural response is fine. But, you know, if you're holding their head up here and their front legs are off the ground and their eyes are rolling back, then, you know, that's probably not a good stance.
Gemma, you've done amazing. I think that you have covered all of the questions. I've just asked if anybody's got any comments about this webinar. Again, we're running these trials for the Donkey Sanctuary. See how you've taken to it, whether it's worked for you, if there's been any problems. So if you've got any comments for us so that we can learn, whack them in the chat there at the moment. And I've got one final question here from, I'll just find it, from a lady named Corinne, who's asked if there are any kinds of dental friendly treats that could clean the molars, such as dental chews that they're for dogs. She has looked before.
Oh, yeah.
Found anything?
Not really. Yeah, not really at all. You are far better off giving your equids natural grazing and hay and whatever else they normally eat. I mean, if it's treats in terms of training, then something that's very low sugar would be the way to go. Something like carrots, we use carrots quite a lot, and actually in dentistry they're a good marker of pain. So if you suspect that your donkey has got pain in the incisors, particularly, there are some conditions that they get as they get older that affect kind of the health of those incisors. You can offer them a whole carrot, and if they bite it cleanly through their incisors, there's probably no pain. If they grab hold of it and they're sort of shaking it to try and break it, or they take it off you and they snap it on the wall or the floor, then that's an evasive behaviour, and that is a sign of dental pain. So I know that's not quite what you asked, but yeah, I would stick to something sugar-free. Yeah, something like carrots, maybe the odd apple.
Okay, so sounds good. And limit the ginger biscuits.
Yeah, I mean, ginger biscuits are handy for administering medication, but you know, when you've got to get medication in them, but as a majority proportion of their diet, it's probably not a good thing.
Fantastic. Okay, thank you all for your comments. We've run over, but it's great that you've had so many questions and so much interest and some real positive things, and people perhaps going to go out and look for some qualified help for the donkeys and actually take it all more seriously with the teeth. Roxanne saying how useful it's been, which is fantastic. So do keep an eye out when you're visiting Roxanne, the Donkey Sanctuary website, for the new dental book, and you can get that, and you can get it in all sorts of forms. I'm sure that you're going to be able to get onto your veterinary provision, and they can have a look at it and get more informed. So we rely on owners to sometimes press professionals to update their knowledge by using our resources, which is great. Great. Thank you very much indeed, and have a fantastic day wherever you might be.